Channel 5 Network. This is Open Line.
All right, good evening and welcome to Open Line on NewsChannel 5 Plus. I'm Matthew Torres. Today we are covering a very important topic, something that NewsChannel 5 has really devoted and done countless stories on. I know we have talked about the opioid crisis, but nowadays when talking about the opioid crisis, we're digging deeper, and unfortunately one of the substances that's really exacerbating the problem and making it worse, not just for the users, not just for people helping with recovery, but law enforcement as well, and that is fentanyl. You may have seen our coverage recently as far as a rise in overdose deaths in Davidson County, particularly possibly because of fentanyl. But really, when talking about just opioid in general, that is something that really has to be tackled and something that really you got to focus so much resources on. And we got a panel of experts to talk about this, not just from the prevention side, but also just handling it overall. And to my right, we have Trevor Henderson, the opioid coordinator with the Metro Public Health Department. To the middle, we have Mary Lyndon Salter with the Tennessee Association of Alcohol, Drug, and Other Addiction Services, otherwise known as TADIS. And finally, all the way to my left is Dwayne Holman, the Executive Director for the Nashville Prevention Partnership. So, if anyone does have questions, I know people are impacted by this. Whether or not you believe it, anyone can be affected by this quote-unquote crisis. It's not just folks you may automatically assume being out there on the streets injecting with a needle. These are police officers, law enforcement, judges, really anyone and everyone. And I think that's why this has been dubbed a crisis, because no one is immune from this. So I just want to start off going down what you guys do, specialize in, and yeah, let's start with you.
I'm with the Metro Health Department, and my role is the opioid response coordinator. So I actually play, in a sense, a small role in helping a lot of other people coordinate their efforts in the community to tackle the issue. So yeah, there's a lot of great people doing great things, and it's just trying to bring that all together to maximize our impact.
And as TADIS, that's the easier mouthful, we run a number of programs, but one that I wanted to highlight is the Tennessee Red Line, which is a 24/7 hotline in order to give referrals for people to addiction treatment or other similar resources like recovery housing, AA, NA meetings, things like that. We have several other programs as well, but we are an association of treatment and recovery providers, so we meet regularly. We work on policy issues, a lot of advocacy issues with the state legislature, trying to make sure that programs are available, funded, and appropriate.
Perfect. Dwayne?
Yes, Dwayne Holman with Nashville Prevention Partnership, as you said before. Thank you for having us all here. I really appreciate these, and I really respect the two to my right here. We worked well together over the past few years, but I work with Nashville Prevention Partnership. One of the things that we do is we teach people how to use naloxone, and in this case we have Narcan kits that we do, so we teach them how to use it, and we also distribute that throughout the community.
I like what you mentioned, that you have worked with these guys before, because it really is a team effort when tackling this problem. So if anyone does have questions or comments, please feel free to call the number on your screen, 615-737+. We will be here for the next hour, so we'll be talking a lot about everything and anything in regards to fentanyl. I think the first question is, we throw out fentanyl, opioid. What is the definition, so to speak, of fentanyl, and why is it so dangerous?
Do you want to speak to this one in particular and how it impacts the brain? And
well, fentanyl, is an opioid, kind of it's a, what's the word for it?
Anesthetic.
Anesthetic, yeah. That was introduced for surgeries in some very severe cases of pain, but it's was marketed for that purpose. Originally, a lot of people, weren't really given it as an over-the-counter, medication for pain. It was more often used in nursing homes for palliative care and end-of-life issues, burn patients, cancer patients, those, very severe pain issues. So it has a medical use, but at the same time, there were people. We got early reports, for example, of people literally going to visit the nursing nursing homes and scraping it off the patches that people would have, attached to them in, nursing home care and whatever. So it became something that people, I think, were being marketed to in a way by a lot of illicit manufacturers from overseas who found that they could kind of flood the market after the interest was kind of there for it. It's very easy to manufacture, it's very easy to ship from overseas, and so it began to flood the market. And because it's cheaper than a lot of the opioids that are available right now, it became something that you could mix with an opioid or give in its pure form, and you could feed that high that somebody had, and at the same time get a really good return on your investment, so to speak. So it's been something that we've had to deal with on multiple fronts, but right now the issue is how it's being used to kind of expand, if you will, and they are blending it with marijuana, they're blending it with heroin, they're blending it with methamphetamine, with cocaine. So it kind of allows them to sell something at a very cheap price for the person who's selling it, but because the person doesn't know what they're getting, they're often overdosing. So that's where the real problem lies, is you don't really have a good sense of what it is you're actually taking.
And I like how you mentioned that, because that is, fentanyl, you see the powdery substance, but when it's being laced in those recreational drugs, obviously methamphetamine, cocaine, that's already being used. I think what's scary is we did a story last week with the Winchester Police Department, how they had reports of marijuana laced with fentanyl, hence why at Bonnaroo, for instance, they had to do some luckily, though, according to the officials there today, they didn't have any reports of fentanyl. But that's scary. Marijuana is widely used, and the idea that anyone who just buys drugs, it could be a lethal purchase at any given moment.
I think you could, but I think it is also good to say that at the moment in Davidson County we haven't seen a lot of that, but it is a real danger. But the other polysubstance deaths that we do see are a lot of methamphetamine and fentanyl, cocaine and fentanyl. But so we are seeing that those combinations expand. So at this point in time, yeah, it's safe to say everybody needs to be careful.
And if I could add, I think it's one of the unfortunate side effects or unintended consequences of cracking down on opioid prescriptions. It's a great goal to have. We certainly don't want people to be overprescribed, opiates, or to even be given them an initial dose if other things are more appropriate. But just because you're not prescribing an opioid to a person who's dependent doesn't mean that they're still not dependent. So they're going to end up going to seek something else. You don't solve the addiction by stopping the prescription, and I think that's something I'd like to underscore, because people still need access to treatment. You don't stop the problem just because you've stopped the prescription.
Well, how is the state doing? I know with the big effort last year, and we've heard from the pain community, for instance, countless worries, and the idea is, are we getting to the stage or a level to where you could cut back on things, but people aren't turning to the streets for these illicit drugs?
It's hard to say. I mean, we definitely have seen prescribing rates go down, and I agree that had to be done. And I think how the state have managed that, they've tried to be careful. There are exclusions in there for people with chronic pain, and you can talk to your doctor about that. Hospitals are doing a great job of trying to show patients that there are other ways of managing pain. For instance, ibuprofen and acetaminophen. You can talk to your doctor about that, and it can be more effective than an opioid. So there are definitely changes. Unfortunately, we are seeing overdose deaths on the rise. So we're still in that shift period, and we're monitoring that really carefully. And as a community of people dealing with this, we're really paying attention to that and trying to plan as much as we can with the resources we have to try and minimize that.
And I think one of the things that addiction treatment providers are having to include in their treatment planning, and certainly their outpatient, discharge planning, is the fact that these folks became addicted because of pain issues, and taking away their addiction does not solve the pain problem either. So they need to have pain management as part of their treatment. And one of the things that a lot of people say as for their clients are expressing as they leave treatment is their fear of pain. And a lot of that will drive them back to use again, because they're very, very afraid of the pain.
Great start. I want to get to our first caller right now. I believe we have Anne. Hey, Anne, good evening. What is your question?
Good evening. She answered part of my question, and I had a background in nursing, and the only time fentanyl was ever used was in the surgical setting. And I've never understood how the market or the United States has been able to be flooded with fentanyl without us not seeing physicians held accountable for the dispensing of it, because I just can't understand the use of it and how people were able to get hold of it. But if I'm correct, she's saying you can get it mail order from other countries, and that's how it's coming into the United States. Is that correct?
That was a large distribution point that's been cracked down on to a large extent by the DEA and the FBI, but it's still coming in through those overseas packages, literally. So yes, it's still coming in, and because of some things that have been put in place to cut down on those packages, now it's being sent in through other countries and then brought by hand through other channels. So a package may get mailed to, let's say, I don't know, Toronto, Canada, and then it gets taken across the border by a mule, essentially.
And she mentioned medical professionals being held accountable. I think that's the power of this drug, is that, again, even your medical experts can be addicted. And I know the Tennessee Board of Nursing, for instance, they recently reviewed the licenses. People had disciplinary actions against them, either going into work high or diverting these drugs, which is an unfortunate side effect of this crisis. You mentioned Davidson County. Where do we stand as far as opioid deaths, fentanyl deaths in Metro?
Well, I mean, one of the things we're trying to also do is just look at all of the overdose deaths, because again, a lot of the deaths are polysubstance, so it's hard to just pick on opioids or cocaine at this point in time. But in 2018, we had in and around 330 overdose deaths in general. Of those deaths, somewhere just over half of those deaths would have involved fentanyl. So that gives you an idea of how pervasive fentanyl is being mixed into all of these other deaths.
And so far this year?
It is early days to tell that data right now. It's until you add those numbers up. In general, we are a little bit over the same time period of last year statewide, but it's something we have to monitor a little while longer before we can tell how it compares with all of last year.
And Dwayne, I want to bring you into this conversation because we've talked about naloxone, Narcan. That's really just a big tool that you guys are using to hopefully combat this. Overall, the use, where are we?
Well, we've distributed right at about 3,000 kits to people here in Nashville. I'm not really sure what the number is statewide, but here in Nashville, Davidson County, that's about where we sit. And we continue to distribute more and more. Our goal is to distribute to, as many people as we can get trained and as we can get the Narcan out to. It's really important because we know that it can save lives. We know that it has saved lives. We also distribute it to our fire department, our police departments, our treatment centers, people who are vulnerable, who have gone into treatment and maybe they've relapsed. Those people are very vulnerable. People who are coming out of prisons and things like that, who may not have had access to opioids, but then you know, because of the disease model, need to get back in or feel like they need to have some more. Those are the kind of people who are vulnerable, and so we're trying to serve as many people as possible here in Nashville.
And Narcan is powerful, which is, again, the brand name of naloxone.
Exactly.
I do want to talk more about this and other efforts that are happening. So if anyone does have any questions, again, 615-737-plus, fentanyl deaths, a topic that we are discussing tonight. We'll have much more after the break.